In the prone position, the obvious bony landmark for the shoulder complex is the acromion process. If you ever get lost in the scapular region, go back to your obvious bony landmark of the acromion process. From the acromion process, it actually turns into the spine of the scapula as it runs a little bit diagonal towards the midline of the body. So from acromion process, palpate the spine of the scapula all the way down to the smooth triangular space. You can actually feel that smooth triangular space. That is at the medial border of the scapula. From that smooth triangular space, we can palpate superior until we come to that superior angle of the scapula. Come back down the medial border until we come to the inferior angle of the scapula. We can come around the corner laterally and palpate the lateral border of the scapula. If in the beginning you're having a hard time palpating this, or your patient has a lot of tissue, a little secret you can do is actually have your patient reach behind their back, and this allows the scapula to actually protract and wing off of the thoracic cage, and you can actually see it on most patients. Going back to the acromion process, spine of the scapula, you can easily see the medial border of the scapula, inferior angle, and then lateral border. Just know, in the clinical setting, you will not be able to do this with 99% of your shoulder patients. They will not like this position. So on the exam, you'll need to do it in this position.